Hello, it's Dr. Rhonda Johnson. Today's Sunday, March 6, 2022. You've heard me say the best COVID infection is the one you never get. But today I'm going to be talking about Paxlovid and why it's so important to inform your doctor about any conditions you may have before you take this medication. But first of all, who is it for? It's been authorized under the emergency use by the FDA for people who test positive for COVID and who are 12 and up. You have to weigh at least 88 pounds. And again, you have to have some coexisting conditions that makes you high risk for progression of serious COVID infection. That includes hospitalization and death. And folks, it's not meant to be a replacement for the COVID-19 vaccines, and it's not to be used pre-exposure to keep you from getting COVID. It is still investigational, which means it's being studied, and many physicians across the United States don't have a lot of direct experience with this drug because supplies up until this point have been very limited. Now, you should know it can only be prescribed by a doctor, and the prescribing doctor needs to know your medical history and what medicines you're taking and what over-the-counter meds and what supplements you're taking. So this is the time to be prepared and bring your information with you before you get treated with this medication. So your doctor will need to know if you have any allergies, if you have liver or kidney disease, if you are pregnant or plan to become pregnant, if you're breastfeeding a child, if you have any serious illnesses like HIV or seizure disorder, high blood pressure, you're under treatment for atrial fibrillation, or even high cholesterol. And the same thing if you're on blood thinners. Because again, this medication, the way it works, one of the components can have significant drug interactions. Please take these precautions very seriously, folks. I'm not trying to tell you not to take it. I'm trying to tell you to bring your information with you to the treating doctor so the doctor will know whether or not you are a candidate for this drug. Now, according to Pfizer's website, there's no experience treating pregnant women or breastfeeding mothers with Paxlovid, and the risk for a mother and an unborn baby is unknown. The Pfizer website actually recommends that women who are able to become pregnant use other forms of contraception, including effective barrier contraception, or do not have sexual activity while taking Paxlovid. And again, patients with cardiac disease really need to talk to their doctors before they take this drug because drug interactions can be very common. That's my message today. Talk to the doctor, be informed, be prepared, and as always, try to prevent COVID. My views are my own.